Assalamu alaikum. Myself, Shameen Sattar. I'm doing my master's in pharmaceutics from Punjab University. My topic of presentation is the fabrication of drug and adhesive transdermal patches for stress modulation, a characterized and optimization study. First of all, what is the transdermal drug delivery system? Transdermal drug delivery system have become an alternative to traditional drug delivery system. It has the advantage of bypassing first pass metabolism, providing sustained drug release, improving patient compliance, and reducing the need for frequent dosing. Transdermal patch deliver the drug to the skin layers to systemic circulation, making them useful for the drug that require stable plasma concentration. They are the layers of skin, epidermis, dermis, and subcutaneous tissue. Release from the base material of the patch, diffusion to the stratum corneum, diffusion to the epidermis, and then diffusion to the dermis, migration to the capillary vessels, and migration to the affected area. This is the way the transdermal drug delivery system work. What is the aim of this study? The aim of this study is to fabricate and evaluate the drug and adhesive transdermal patches of buspirone and lavender oil, the effect of adhesives and solvent, and the study drug release behavior. What are the objective of this study? Buspirone suffers from low oral bioavailability due to extensive first-pass metabolism. Transdermal delivery offers a viable alternative by providing a controlled drug release, improved bioavailability, and immediate effect by infusing the lavender oil, buspirone, and anti-anxiety medication. Material which is required for the fabrication of the drug and adhesive transdermal patch of buspirone and lavender oil. First of all, buspirone, lavender oil for the immediate effect, which provide the relief from the stress, immediate relief from the stress. Rosin, rubber, and zinc oxide form a very adhesive mass, which provide the adhesiveness to the skin. Ethyl acetate and hexane, ethanol, water are the solvents that being used in this formulation. Backing layer is a surgical cloth that has been used in this formulation, and while the release liner is a siliconized paper. Chitosan and PVP are for the trial, it is optimization study to check the which adhesive works the best. About the methodology, transdermal drug and adhesive patch of buspirone and lavender were formulated by the solvent casting method. The drug was dissolved in a solvent and mixed with adhesive mass, cast on the backing film, dried. A release liner was attached, cut into patches, and evaluated for the dissolution study. Single layer drug and adhesive has a backing drug and adhesive matrix, and then the liner, release liner, which in this study has been used a silicon released paper. What are the evaluation parameter for the drug and adhesive patch? First of all, uniformity of weight variation, thickness, which is made by measuring the thickness by using the vernier caliper at the 3-point central and from the sides as well. Moisture content by placing the cut the patch into the size and then place into the desiccator, weight it for initial weight and minus the final weight divided by the initial weight multiplied by 100. Folding in endurance, which is the folding capacity of the patch until it break. Percentage flatness test, tag test, and the peel adherent test. Peel adherent test is performed by using a universal testing machine. Using the assembly for the peel adherent test, the patch is attached onto the assembly, and then it is performed and giving the force in the Newton. And this is giving the force required to peel off from the skin. In vitro drug release evaluation, including assay, performing the assay, content uniformity, and the dissolution, how the drug how the drug is releasing from the patch, and the dissolution apparatus, modified dissolution apparatus has been used in this study. In vivo study include behavioral study using the elevated EPM test for the rats, having the three groups for the rats, a control group, having gnome drug introduced into that group, and the drug with the oral group, and the last one with the patch group. And in this way, these parameters are being performed. Results after the formulation shows that ethyl acetate, the solvent, the formulation which is formed by using the solvent ethyl acetate is the more successful. Ethanol doesn't form any proper adherent, so it is a poor adherent being short by this. And hexate drug doesn't dissolve. Chitosan, if the formulation has used the chitosan, but there is a no adherent formed by it. PVP, it is PVP K30 is a pressure sensitive adhesive, but it hasn't showed the adhesiveness. Ethyl acetate plus and hexane is used in 1:1, and it was being successful. Solvent system affected performance, changing the drug concentration, also affecting the drug release, and adhesive concentration affected the drug release. These are the factors which is being studied while doing the dissolution and other thickness and other parameters being recorded. And then these show that if we are changing the solvent system, it has affected its performance, and same about the changing the drug concentration and adhesive concentration. Drug release kinetics of optimized formulation, which is being which is being formed by ethyl acetate, followed the Higuchi model, indicating the drug release is primarily governed by the diffusion from the adhesive matrix. The Cross-Meyer-Pappas model showing an exponent n between 0.5 and 1, confirming a non-Fickian diffusion mechanism where both diffusion and polymer relaxation contribute to the drug release. This demonstrated that the adhesive matrix effectively controlled drug diffusion, making it suitable for the transdermal delivery. I have shown the first order kinetic, how it's following the first order kinetics, zero order kinetics, Higuchi model, and the Cross-Pappas model. Conclusion, the optimized formulation was 40 milligram of the drug of buspirone that is being used, plus 1.5 gram of adhesive mats, which is rosin, which include rosin, rubber, and zinc oxide as a stabilizer. The mixed solvent system improved the result and was suitable for the transdermal delivery. Adhesive and drug concentration affected the drug release. Future work perspective includes in vitro skin permission study using France diffusion cells, optimization of batch size for clinical application, incorporation of advanced penetration enhancers, and stability studies. Further research will focus on kinetic modeling, in vivo evaluation, and the development of advanced transdermal patch for the improved therapeutic efficiency. Thank you so much from my side. If you have any question, you can ask. Thank you so much.